Hi, Dr. Paul Brumett with Hero Braces. Wanted to welcome you today for our slide presentation of Canine Orthotics and You. Before we get started, there's a few folks I'd like to thank. Ben Blecka, owner and head orthotist prosthetist of Hero Braces. Ashley York, orthotist prosthetist at Hero Braces. The staff at Hero Braces who make my life easier every day. And Carrie Adrian. All of these folks gave me feedback and helped create this presentation. So just a big thank you to all of those folks for their expertise and knowledge. A little bit about myself. I've been a practitioner for over 20 years. I've worked as a mixed animal practitioner, small animal practitioner in emergency medicine, and in the last few years have gotten my certification in rehab and as an animal chiropractor through the American Veterinary Chiropractic Association. And own a practice in Grand Junction, Colorado called Animal Tracks Rehabilitation and Fitness, where we are focused on rehabilitation of small animals and then chiropractic of small animals and horses. So a little bit about what we're going to be talking about today, our objectives. We're going to talk about the history of orthotics and prosthetics, a bit on biomechanics. We won't get into that too deeply. Current research that's out there, how we use orthotics in veterinary medicine, the casting impression process, the fitting and common complications we see with custom orthotics and braces, how we take care of them, and then that'll be our first hour. And then in our second hour, we're going to go over some case studies. And these will be cases that I've specifically worked on in the last couple of years in my own practice. And I wanted to be able to show everyone what's possible. So we'll start out with some prosthetics, and here we have the big toe, a wonderful prosthesis that was created for an Egyptian noblewoman about 3,000 years ago, and someone took great care to create this lifelike toe. Has a very interesting, looks like way of attaching to the foot, and of course, sandals were a big part of footwear at that time. You needed a big toe to wear a sandal correctly, and certainly it helped with the identity of this person and was allowed them to be functional in society. If we move on a little further, between the 1500s and 1800s, we find these iron hands. And if you were a soldier, there was a possibility that you could lose a hand during warfare. And so what did you do when you needed both hands to hold a spear, a sword, and a shield? And so the local blacksmith could make this prosthesis. You can see that the arm went in, was held on. You can see a buckle here, so it was held on with some straps. There's a ratcheting mechanism that helps open and close these fingers. And so it created a way for these soldiers to go back and be functional. And then here's another example of a prosthesis. This is from the American Civil War. And James Hanger was considered one of the first amputees of the war. And he created what was called the hanger limb. And so the story goes that he sequestered himself after he got injured and for several months and came up with this idea. And I think it's really interesting to see that we've got this joint at the knee and a joint at the ankle. That this was patented in 1871 is just phenomenal to me. The way that this was held on was basically with a set of suspenders that helped keep it in place, which is different from how a prosthetic is held on today. But very, very interesting. Really neat to see that this was going on in 1871. And then as we move forward, there was a big influx of amputees from World War II. The artificial limb program was started, and that was a number of government, military, and private agencies, universities that worked together to create advances in the development of these prosthetic devices. as we've moved forward into the 20th century, we now see things like 3D scanning, 3D printing, the use of carbon fiber, vacuum molding of plastics, the integration of electronics. MIT has a fully functional ankle now. They're working on neurointegration. So things have come a really long way. And I think it's going to be really exciting as in the next few decades as we start to think about how can we use these things in veterinary medicine. So now we're kind of making a transition to orthotics, and Hippocrates was known as the father of modern medicine. Gosh, he was involved in all kinds of things. And he was known to use braces and splints for the treatment of fractures, dislocations, and congenital deformities in the 4th century BCE. In the middle of the 20th century, polio was quite a big deal. My father talks about seeing folks wearing these braces. And certainly, if you got polio, you could have neurologic damage where you needed to have some type of support so that you could walk around. And so these steel and leather lower limb orthoses were created. And here's several different examples to help these folks get around. So as we've moved forward with orthotics, the design of a lot of them hasn't changed very much. And here's an old one leaning up against in a doorway. The leather straps have been replaced by Velcro. Orthopedic shoes are now made of a dynamic ankle brace that's out of carbon fiber. We have lighter splinting materials that we use instead of steel. And they're more friendly to the client. So they fit better, they function better, they're lighter because of the materials and increase in the new designs. Once we get into veterinary medicine, it's a fairly young industry. Orthotics and prosthetics is in the veterinary world. They've been around about 15 years. The industry was started by a small group of veterinarians, physical therapists, and prosthetist orthotists. And right now there's about 6 custom manufacturers in the United States. Here's a dog. This is Farley. We'll talk about Farley here in a bit. Farley's wearing bilateral carpal braces. And this is the Red Rocks area of Colorado. So if you come visit Colorado, or if you're from Colorado and you go just west of Denver, and there's a wonderful area there called the Red Rocks, and they have a great stadium to hear music at. A bit on terminology. So first we're going to talk about a soft brace. So a soft brace generally gives mild to moderate support. It can be off the shelf, or it can be made customly by taking some measurements. We can even add a layer of thermoplastic to help increase support. And here are some examples. This is a carpal brace, and then here we have a tarsal brace. So a bit on prosthetics. Prosthetics is the science of creating an artificial body part. A prosthesis replaces the missing limb. And here we have a dog who was found frozen to the ground, had to have amputations of the distal part of all 4 limbs. And so these prostheses were created to allow this pet to walk. And one thing that is always fun to note, this dog has a left on its left front prosthetic, and I've found that in my own practice I have to do this too. It really helps prevent the client from being confused, and certainly I've put bilateral carpal braces on before and got them mixed up, and then realized once they were on they were backwards. So just a quick little tip to help you down the road. With custom orthosis or a custom brace, what we're looking for is to support an injured or weak limb, and this can be in a static or dynamic way. And here we have some examples. This is a Stifle brace here. Here we have those carpal braces we saw earlier on Farley. And then here we have a sneak peek at a case we're going to talk about in our second hour. You can see there's a tarsal brace here, and then in the back we have a custom soft tarsal brace with some thermoplast. So a bit on research. Our first paper is Biomechanics of an orthosis-managed cranial cruciate ligament deficient canine stifle joint predicted by use of a computer model. So this research team used a 3D model to evaluate the effects of a stifle orthotic on CCL deficient stifle. And what they concluded was that the joint biomechanics were improved following implementation of the orthosis compared to the biomechanics of a cranial cruciate ligament deficient stifle joint. And they also found that, and they also concluded that an orthosis could be a viable option to stabilize a cranial cruciate ligament deficient stifle joint. The next paper was on kinematics. So pelvic limb, it was titled Pelvic Limb Kinematics in the Dog with and without a stifle orthosis. And kinematics looks at is a branch of mechanics that looks at motion of objects without reference to the forces which cause that motion. And they used kinematic data to evaluate the effect on the stifle joint in 6 healthy dogs. So they placed these dogs in a stifle orthotic and then watched the joints move. And what they found was that the stifle orthosis had an equal or greater effect on the motion of adjacent joints, and especially the tarsus. So what does this mean? And it is always the question I get. And well, so the couple of things we need to look at. One is that we need to look at what this study does with dogs that have a cruciate deficient stifle. We also need to think about how do we improve the brace to get what it is that we want done. So we need to look at the biomechanics more. And the third thing is, how do we harness this? Sometimes you find out things in a study that actually lead you in another direction and make things even better. So what do we do to alter the orthotic to make sure that we're placing the forces where we need them, that we're getting the motion in the joints that we want, and eliminating the motion in the joints that we don't want? Our next study was a comparison of owner satisfaction between a stifle joint orthosis and a TPLO used as management of the cruciate ligament disease. So this was a retrospective study. About 25% of the owners who chose an orthosis responded, and about 37% of the owners who chose a TPLO responded. It's a decent amount. If you know anything about statistics, at least what I've been told about it, is that anytime you do a survey, if you can get 10%, you're doing really well. So I think in this study, this was a decent response. And the conclusions were that folks that had, whether they had a dog who had an orthosis or a dog that had a TPLO, that they both had a high satisfaction rate for both interventions. Now, one of the things that they also talked about was when you consider non-surgical management, such as an orthosis, you need to educate your clients on potential complications. And we'll talk more about that when we talk about client expectations, but a good point. This next study, the use of canine stifle orthotics for cranial cruciate ligament insufficiency. It was another retrospective study. They looked at weight bearing for unilateral cranial cruciate ligament insufficiency while using a custom orthotic. And their conclusions were that it allows improved weight bearing in the affected limb, and it should be considered for cases with concurrent medical conditions or financial constraints that do not allow for surgical intervention. And then our last study was an evaluation of using a carpal brace for the treatment of carpal ligament instability in dogs. And so in this this particular study, it was a retrospective study. There were 14 athletic dogs. They had all been diagnosed with a unilateral carpal valgus or varus instability, and they used a custom soft brace, a neoprene carpal brace, and then they added in passive range of motion and isometric strengthening during the application. And their conclusion was that the use of a carpal brace resulted in improved stability and resolution or reduction in lameness in dogs with carpal ligament instability. And 12 of these dogs actually were able to go back and compete. So what does all this boil down to? What does it all really mean? And I think there's a couple of key things here. Custom orthotics and braces can be a viable alternative for surgery and an effective treatment. And the other is we need to do more research. And there is currently some research going on in Cambridge that's looking at the use of Stifle braces for cranial cruciate ligament deficient dogs. So we're continuing to get more and more information, and as we get more and more information, we can get better and better at producing custom braces, custom orthotics, and finding the things that are key to success in those orthotic designs and implementations. Reasons to consider a custom orthotic. What are our goals? We want to rest an injured limb, whether it's a cranial cruciate ligament rupture or carpal hyperextension. We want to protect that limb from further injury. We want to help that pet return to function. So from a client standpoint, that's going to be that they're able to go on walks again, or maybe even perform at an athletic level. We want to be able to assist, prevent, or correct abnormal movements with the custom orthotic. We want to get the pet to bear weight sooner, and we want to decrease muscle mass loss by having them bear weight sooner. And the last thing that we can do is we can use these in place of multiple splints. And in our second hour, I have a case where we actually did that. So instead of using a bivalve splint for several months, we used the splinting just long enough to get the custom orthotic. And then once we had the custom orthotic, we could use it in its place. So some of the uses of orthotics we've touched on just a bit: the cranial cruciate ligament rupture, Achilles tendon support postoperatively for full Achilles tendon ruptures or transections, or for support of those partial tears, for carpal hyperextension, valgus and varus injuries and deformities. There are soft braces now that incorporate a hobble system that work really well for medial shoulder instability. We can use orthotics for the support of orthopedic repairs, especially during athletic use, stability and support for failed arthrodesis, so those pancarpal arthrodesis that just don't want to heal. And we can also facilitate ambulation for our neurologic pets that are knuckling or have dropped hocks. So a bit on biomechanics. To be effective, a custom orthotic must counteract the forces that are creating the problem. So if we think about how we test for cranial drawer, and we've got this nice little diagram, you can see that if this person is performing the cranial drawer test, the red arrows indicate the abnormal movement, and which would be the tibia moving forward as we hold on to the end of the femur. And then how we correct that is we have an opposite or opposing force. So where these green arrows are, if we push back against the tibial crest, then we can eliminate that cranial drawer. If we push back against the tibia, then we can continue to stabilize the femur. And so here, if you look at this Stifle brace, the key is to look at where the plastic is. So the plastic is in front of the tibial crest, which is going to be right here, and it's going to be behind the femoral condyles. And so these two forces allow us to reduce cranial drawer and stance phase. The next concept is a long lever arm. So a long lever arm is going to create less force over the limb, and less force equals less pain. So one way to think about that is if you take a very short lug wrench and try to tighten these lug nuts, it takes a tremendous amount of force to push down on the end of that lever. If you make that lever longer and put force on the end, it doesn't take as much effort to get these lug nuts tight. And so when you look at this Stifle brace, it goes from the tibial crest all the way down to just above the calcaneus. And so this is the long lever arm. It transfers those forces over a larger surface area, and that it helps prevent sores. So here's an example of a cruciate tear, and generally when I give this presentation in person, I'll ask for people to raise their hand and to see how many people have actually seen a dog tear their cruciate ligament, and a large majority of us haven't. So here's a recording of a dog that is just having a good day, racing around in the backyard, and bang, next thing we know, we're three-legged lame. Let's watch that again. So just having fun, running around, and right there we come up three-legged lame. And this is what we see right after that. This is what sometimes we even see the next day in our exam room. It's this three-legged dog who's toe touching and uncomfortable. All right, our next slide is Gus. So let's get Gus going here. So I put this slide in because I wanted to demonstrate that we can brace these little dogs. One of the things that we find with our pets that have a large thigh and a short femur is that if they have any redundant skin, that it can be difficult to get a brace on them. So one of the things that you want to do if you have one of these smaller dogs is to take some pictures from the front, side, and rear at ground level and send them to your manufacturer and make sure that everything looks okay. If there's a lot of redundant skin, if the dog has a really fat, short leg, then they may have to accommodate for that. So just ask the manufacturer. That way they'll be able to help you. And then here we have a Stifle brace on Miss Morley. And you can see when you look at Miss Morley that she's lost some muscle mass in her rump. She's wearing a custom Stifle orthotic. We've got our toes externally rotated and we're up on our toes a little bit. Here we are 6 months later. She's been doing physical therapy along with wearing her brace 8 to 12 hours a day. And you can see she's standing with good weight on that foot. She's gained muscle mass back, and she's doing well. So moving forward with our biomechanics, the next thing is a 3-point system. This is an example of a tarsal orthotic, and we'll talk a little bit about the different parts. So here's the plastic that is the corrective force for the collapse of the tibia. And then here is the plastic that is creating the corrective force for the collapse of the metatarsals around the ankle. And then we have a ground force that is going up through the paw segment, and that actually helps keep everything in place. And the straps are just there to help hold it on through the swing phase. So 3-point system. And then here's a case using one of those orthotics. This is Cammie, and you can see by looking at this picture that Cammie has sores on both of her hocks, on the tops of her toes, and she's knuckling. And we're going to use a custom orthotic to help her. Okay, so here's a video of Cammie walking, and you can see that knuckling that she was doing, how she drops in the hocks. And certainly you can get a little bit better picture of the different abrasions she had. Cammie had a soft tissue tumor that was impinging on her spine. So here's a video of her 5 minutes after putting her in a custom tarsal orthotic. This is an early version of what we use now. Let's take a look at that one more time. Her hocks aren't collapsing. She's no longer dragging her toes, and she was doing really well at that point. This next slide is a video of Cammie a year later walking in her custom orthotics. You can see that her hocks aren't dropping, that she doesn't have any abrasions anymore, and there's no knuckling. And certainly she still has a bit of an abnormal gait. That is mostly due to the tumor that she had. Okay, back to Farley, our custom bilateral carpal brace case. As you can see from this picture of Farley, he had carpal hyperextension of both front limbs. The right side was worse than the left, and it was decided to put him in a custom carpal orthotic. Here's a video of Farley walking in his custom orthotics.
Come on, Fred. Come here, buddy.
So Mom thought he kind of walked like a tin soldier. It was very endearing to her, I think. He's doing really well, and I think it's really common for these guys to be a little hesitant at first to walk around in these braces, but definitely having them on both front limbs does not slow them down. And as you can see, and we'll watch this video one more time, Farley's getting around pretty well.
Come on, Fred. Come here, buddy.
Here we have Farley 3 years later. You can see that the left carpus is essentially in a normal standing position, and the right carpus has a bit of hyperextension, but not too bad. Farley at this point was wearing his braces on rare occasions, but was doing well. Creating a casting, the key to a proper fit. The casting impression is used as a reference to build the orthotic or prosthetic around. So if we create a poor impression, what we get is a poor orthotic with poor fit. We need an intimate fit to help eliminate common problems like discomfort or sores or poor use. So creating a good casting is an important part of the process. Some of the keys to be successful creating a casting are to place the casting material tightly, to extend the casting material above and below the joint in question, generally to the next joint or higher or high into the groin. We want a 50% overlap of the casting material, and we want to position that limb in a normal standing position. And this is going to vary depending on the manufacturer. Some of the companies like to have the Stifle brace done with the dog standing, and others like to have them in lateral recumbency. So check with your manufacturer before you do your casting. So a bit on the different supplies that you're going to need. Pretty much everybody has a casting kit that they'll send you once you order a custom orthotic. Let's go over a few of the things. We're going to have stockinette or plastic wrap, and that is to cover the limb and help protect it from the casting material. You'll have a cutting strip, and so this is a plastic strip that has a rolled edge on either side and a groove, and I've got some pictures later on that'll show that a little better. A set of gloves, a measuring tape. Depending on the manufacturer, some folks want several measurements, others just want one or two. Some bandage scissors to cut that stockinette or plastic wrap when it's at an appropriate time. A hook blade carpet knife, and I'll show you a different view of that later so you can see that actual hook blade. The casting material itself, which is typically a fiberglass casting tape. a bowl of water. You want to make sure that that water is cold so that the casting material doesn't set up too quickly. A camera of some type and a felt tip marker so that you can label the casting. Some of the manufacturers will also ask you to label bony prominences or to make tick marks on the surface of the dried casting so that they can create the proper alignment. So now we're going to talk a little bit about the process. And so certainly we want the casting material to be on very snugly. This doesn't stay on very long. We don't put any padding in here because if we put padding in, then it eliminates the bony landmarks. And I think everyone can see the calcaneus here, the tibial crest, the front of the femur. So we want to see those things. And if we were to put padding in here, then we wouldn't be able to pick those out. So first thing we're going to do is we're going to put that stockinette or saran wrap on the leg. There's no need to clip the fur. The fur is going to be there underneath the orthotic. It acts as natural padding, so we don't need to take care of that. We've already talked about cast padding. We don't put that on there. The next step is to place the cutting strip on. If you're using stockinette, we'll cut a little hole in the stockinette here and a little hole up high and thread that through so that the cutting strip is on the outside of the stockinette, but under the edge so that it doesn't slide around. We're going to figure out where our bony landmarks are and make sure that the cutting strip doesn't go across the ones that are important. And that does vary a little bit manufacturer to manufacturer, so check on that. And then we're going to start from the bottom, and we're going to do, for the Stifle brace, which is what this one is illustrating, we start just below the calcaneus and start to do our wrap 50% with a 50% overlap. A couple of key things that people get themselves in trouble with. Don't open the casting material until to the moment you're ready to use it. That once it's exposed to the air, it will draw moisture in and start to activate. And if you live in a really humid climate, it will activate pretty fast. The other thing is to use cold water. With cold water, you actually lengthen the time for it to cure, so it gives you a little more working time. After you've done a few of these, it doesn't become as big of a deal, but certainly in the beginning, give yourself a little extra time and use cold water. We want to take that casting material high up into the groin. So we want to include the joint above and below. We're going to, in some of my hairy dogs, we'll place a towel right through here to help just keep some of the fur out of the way. And then we have our very important person here, our assistant, that is pulling up on the stockinette or the saran wrap. And this is important because we want to make sure that we get as little fur in the casting material as possible. It certainly happened to me. You can take your finger and kind of run right along this edge and get that hair to release without it pulling on the dog. But it's a lot nicer not even have to do that. Here you can see the little hole that we cut in the stockinette, just to thread that cutting strip through so that it didn't get in the way. And then I don't know if I think you guys can see that there's a 50% overlap. And then in our next slide, we'll talk about how we run that down. So we're going to do the crisscross. And so this creates 3 layers for us. So we have our 50% overlap going up the limb. And then we come down at about a 45-degree angle and we'll just spiral back down until we get here. Now, if you have extra material left over when you get back to the end of the calcaneus, or if you're going back to the bottom of the foot, if you're doing a carpus, you don't need to continue to wrap that material. Just clip it off, wet your hands, and massage these layers back together. Once you've got the material on, then we want to position the limb while the casting material is still soft. Notice that the technician, our very important person, still is pulling up on this casting, or I'm sorry, on the stockinette, so that the casting material doesn't get into the fur. As this starts to harden, you want to make sure that you that you pull down, and then my next slide demonstrates this. You kind of want to pull down straight on this leg, and that will help reduce the drawer. You also want to remember, and this is the part that I normally forget because I get excited, we've done a good cast, I know as soon as it hardens we're going to be cutting it off, that as it starts to firm up, it's a good idea to take a picture from the front, the side, and the back so that the lab can actually see what the cast looked like on the leg. So here's that positioning slide we were talking about and reducing the drawer. So basically this is the top line of the dog. We've got a hold of just above the foot, and we're just applying slight tension down, and that will help reduce this drawer so that when the lab looks at this, they're not trying to adjust for that. So when it comes to cutting this material off, we're going to use this hook blade knife. And so here's a view of what that little blade looks like. It's a guarded blade. These, when you get your casting kit, this will come in it. But these can be picked up at the hardware store too. And if you break the tip off of this one, you can take this apart and flip that blade over and have a second. So the first thing that we do is we cut just a little bit of the stockinette that's in the way out, and then we're going to draw that blade along the casting material down the center of this groove with slight pressure, and that's going to cut this. Now if this material, generally I wait till this material has kind of a hollow sound, so I'll take my scissors and I'll actually kind of tap it on the side, and when I do that it kind of creates a hollow sound. I know it's gotten hard. If you start to cut this and it starts to fold up or crinkle as you cut it, then you know it's still too soft, and just give it a little more time to harden up. So we want to make sure that that blade stays in its groove, and just another reminder to take some pictures of that casting while it's still on the limb. So once we've got that casting material cut, then we'll come back with our scissors and we'll cut the stockinette or saran wrap out of the way, and then we'll actually take the cast and pry it open a little bit and slide it off the limb. And if you're high into the groin, just check for hair, run your fingers around that, make sure that you don't have anything stuck in there. Certainly as you start to pull the cast off, if it's not wanting to slide, check and make sure that you didn't forget to get a little hair out, or maybe sometimes I've actually gone through and thought I cut all the stockinette and missed a spot, and so I just have to go back and cut that. Once you take it off, you'll just kind of hold the edges back together. Some of the manufacturers will have you put some tape around it to hold it in place to help keep things in alignment. And then you'll label it. Here you can see we just did a quick little label, and typically I'll put my name on here, the practice name, whether it's a left or right, and the pet's name, and you ship that off to your manufacturer, to the lab, and it typically takes about 2 to 3 weeks for them to take this casting and turn it into a custom orthotic. So here are some finished castings that were done by students, and I just wanted to point out a few things. We could use any one of these in the lab to create an orthotic. So they did a good job there, and certainly when we look at things, we can see bony prominences. So here's the calcaneus, the accessory carpal pad and carpal bone, the back of the elbow, tibial crest, calcaneus here. So you can see how these bony landmarks stand out, and the lab can take measurements off of those. What happens in the lab is they seal this up and they fill it with plaster, and then they remove the cast from the outside of the plaster, and then they'll do what's called a buildup. And so they actually create extra space in places where they need it by putting on more plaster, or if they're using a 3D process, they'll actually they'll do a 3D scan of the casting and then create basically a fake leg, and then around that they build the custom orthotic. Some things that these students could have done better and things that you can look for in your own casting is this particular cast of the Stifle didn't need to be started as low. It could have started right up here by the calcaneus. We just need a wrap or two to know where that is. And then that does depend on the manufacturer. So for us, we just need it right here. Some of the other manufacturers sometimes want to include the paw. So talk to them about that. The overlap here is certainly more than 50%, and we could have saved some casting material if we've done a 50%, and there's no downward spiral. So a downward spiral would help create this, make this casting tougher. With this particular, this was the casting that would have been done for a tarsal brace, and so it includes the paw. So you can see the material starts here below the foot. This flat piece is where the cutting strip came out, and so we wrap up 50%, and then we come back down at a 45. They kind of wrapped up and down in the same plane. Not the end of the world. Certainly, we can see all of our bony landmarks. I would like for this cast to be a little taller so I could really make out the tibial crest. So that's a couple of things that I see in this one. And then on the very first one, in pretty good shape. We could probably have gotten a little bit more angle in the paw. When you make a casting for a front leg, you want to take the material and actually put your hand in it. So I have, let's see if I can get this in the camera here. So here's a casting that we made of a front leg. And when you wrap this material, after the material is wrapped, you're going to take your hand and you're going to put your hand right here, and you're actually going to hold the leg and put the foot up in a normal standing position, just like that. So I'll wrap the foot, put my hand right here. Pinky is right at the top of the carpus. And I'll just push up and get that foot in a natural standing angle. And especially with the carpus, if you've got a varus or valgus deformity, I'll look at that and just make sure that I've got the carpus in the most natural alignment that I can get it in, and in the right standing angle as well. So if you're casting for a prosthesis, a couple of things that you need to know. First, you need a minimum of 1/3 to 1/2 of the tibia radius remaining. And it's always best to contact the company that you're working with for advice and direction before you do the surgery, if it's possible. They're going to want things like pictures, x-rays if you've got them, pictures of the normal limb, pictures of the abnormal limb, and all from a ground level. So we always talk about from the front, the side, and the back. They may also ask you for measurements, and remember that a few questions are going to save you a lot of time, a lot of heartache, and a lot of money. The casting, fitting, and follow-up protocol that I typically use in my practice is I schedule about 30 minutes for the casting, and we do that as soon as we can. So if I see a patient and they've got a cruciate ligament rupture, and we've discussed all the different options and talked about surgery versus a custom orthotic, and the client decides that they want to go with a custom orthotic, then we either try to do that right away or schedule it within a few days so that we can go ahead and get that custom orthotic back as soon as possible. And then in 2 to 3 weeks, when that cast comes back, then we're going to put them in, go ahead and do a fitting session and put them in that brace, and we're going to teach that owner how to put that brace on and how to take it off and how to take care of it. So that typically runs about 30 minutes. Now in my own practice, since I'm doing rehab, we'll do some rehab, some laser therapy, some other things, maybe some animal chiropractic to help those guys as they continue to improve. So rehab is going to be a part of all this process for me. But and certainly when you're first doing this and kind of getting your feet wet, taking a little more time to so that you don't feel rushed is appropriate. And then a couple of weeks later, you're going to do a follow-up appointment. You're going to check fit, see what problems the client is having. If they're having problems with rub sores or something like that, which we'll talk about here in just a minute, then certainly it's a good time to address those things, if not sooner. One thing that I get asked a lot at conferences is, is this something that our technicians, our veterinary nurses can do? And absolutely, these folks are well trained, and you can, as a veterinarian, you can do diagnosis and treatment, and they can learn how to do this casting process and turn out a very good cast and take that off your plate so that you can do other things. So managing expectations, this is a big part of bracing, and I think that even in my own practice, that each day I strive to do a better job of this. You want to make sure that you're using the proper device for the condition. So if you've got mild instability, then maybe a soft brace is the right way to go. But if you've got major instability or really bad hyperextension, or if the hock is on the ground, then a custom orthotic with hard plastic that's going to give you the most support is the right way to go. You want to make sure that the client knows that they're going to need to use this orthotic on a daily basis, and we recommend 8 to 12 hours a day to get the most bang for your buck. It can be off at night while they're asleep. Some dogs, depending on how wild and crazy they are, may need to have some sedatives added to their daily regime for a while, so that they don't race to the front door without their brace on and create more issues for whatever their condition is. I do have patients in my own practice that sometimes never get to a full wearing schedule. The owner doesn't trust the dog to wear the brace all day, which in my experience, because it's a custom fit, I give in the very beginning, as we do the break-in, we really watch the pets. But if they're not chewing on the brace early on, they generally don't unless there's a problem. So I have plenty of clients that their dog wears the brace 8 to 12 hours a day, and they're not there watching them 24/7. But there are folks that don't trust their dog and will only have it on when they're home, and so they may not get to that full wearing schedule. We still see improvement. The owner is still happy with the outcome, and we're still helping the pet. So as a practitioner, I always want things to be perfect, but the reality is that it's not, and we can still help these pets. About 15% of our pets are going to have a fitting issue, and it's why we talk about the casting process and about getting a really good impression, because that can really help with eliminating tight spots if we get a good impression. But typically what we're going to see are sores or rub spots. It's usually because the owner's not putting the brace on correctly, so the straps that wrap above a bony prominence to hold things in place are put on too loose, and so things move around. But at times we need to reshape the orthotic as well. So in the lab, maybe the build out wasn't as much as we needed to have, and these are custom products. There's definitely an art to all of this, so sometimes we do need to make a little bit of a change to get something to fit just right. And then about 10% of them fail, and I think there are a few things that can contribute to that. Sometimes we have a client that doesn't realize that for the next 6 months their dog's going to have to wear a brace every day, and how much time that takes. Certainly I have, and usually I have my clients tell me that usually within a week or two, the dog has figured out the new routine. If it's time to go on a walk, and they've been sleeping in their kennel or hanging out in their quiet place, and it's time to put their brace on, they lay down, they stand up, they in the proper position, and the brace goes on very quickly. So that doesn't tend to be an issue, but there are other folks that it's a hassle for them for whatever reason, and so they don't use it as well. Sometimes we'll have the wrong brace for the wrong condition, and by that I mean if you have, let's say you have a meniscal tear on a dog, if you brace a dog that has a meniscal tear, they're generally not going to bear a lot of weight on their foot because there's so much pain from the meniscus, and so we have to address that meniscus first before we brace them, or we need to take them into surgery and do some type of surgical procedure other than bracing. So those are a couple of things that I see reasons that they fail. Certainly there are just some dogs that never like to wear something on their leg, but in general I think most of us practitioners are on top of that. We know to ask those questions. You can certainly, if you've got a dog that you're worried about that you don't think's gonna wear something well, put a light bandage on that foot and see what happens, or a light bandage on that leg and see if they tear at it, or if it's comfortable, or if it doesn't bother them. Certainly with cats, some cats, I had a cat that I worked with that wore a custom device for several months and didn't bother it hardly at all. We made a few changes as we moved along, and he did very well with it. But other cats, you just put a little vet wrap around their leg, and they immediately go after it. So those animals may not be a good candidate. And if you move forward without checking those things out, then there's a good chance it's not going to go well. So here's a picture of a couple of rub sores that I've actually seen in my practice. This was with a tarsal brace, and you can see these areas, and it's obviously in a thin hair dog, and you can see there were these areas of hair loss along the leg. What was happening was this dog was in a tarsal brace, and it wasn't being applied as tightly as it should. Sometimes clients are a little wary of causing too much. We've all been taught that a tight bandage causes foot swelling, so we're all careful, and sometimes owners are a little bit too careful. They usually figure it out, but I work with them with that in my clinic sometimes. But in this case, once we got the straps tightened up, these actually healed over and were fine. And then here's another case, same kind of thing. This was a carpal brace, and it was just slipping up and down and causing this sore. And once we got the straps tightened up, that problem went away. I guess one thing before I move on to this next slide, just to say that most of these rub sores, if we catch them really early, you can take care of them very quickly just by making some adjustments. Certainly if you have questions, contact your manufacturer, and in the second hour we'll talk about different ways that we can figure out why there's a problem. So our wearing schedule or break-in schedule. So at the initial fitting, we're going to do about a half an hour in the brace, and then we're going to take that brace off and check the skin. And I'll usually, in my practice, I do this for 2 or 3 times during day 1. And then on day 2, we'll have the pet wear the brace for an hour. We'll do that for 2 to 3 times. And each time we take it off and make sure we're not getting any rub sores, watch the dog's behavior. Certainly in the very beginning, we want to do something that the dog likes to do when we put the brace on there, so that they don't think that it's any type of punishment, or that it's not fun. So I always tell my clients, put that brace on and take them for that short walk. Let them go smell the trees, check out what information the other dogs have left. And then each day we're going to add an hour to the wear time. So on day 3, we're doing 2 hours, 2 to 3 times a day. On day 4, we're up to 3 hours a couple of times a day. And then we just work our way up to 8 to 12 hours a day. What we find is that with the Stifle, that 6 months of full-time, meaning 8 to 12 hour a day wear, that a lot of these dogs we can wean off of the brace. They get functional shortening of the medial and collateral ligaments, thickening of the joint capsule, functional buttressing, and so they can get around without the brace. But we typically still keep it on if they're doing something very athletic, so like going on a hike, doing a lot of stair work, so that we can protect that knee. And then other braces, it kind of depends. So some of our post-surgical braces we'll have pets wear for 3 to 6 months. Other dogs need to wear something for life if they're knuckling, if they're neurologic. Some of the pan-carpal arthrodesis, some of those need to be in the brace for over 6 months to actually see things heal. And if some never stabilize, then you may have to wear it long term. So the care of these braces, it's really pretty simple. Most of them you just clean with soap and water and you air dry them. The foams, the neoprene, the straps, all of that, because they all are polymers, you don't want to stick them in the dryer or apply heat to them because you can make them shrink or warp. But they're typically waterproof. They can be used during swimming, underwater treadmill sessions. I've got one pet that runs around in the snow all the time with their owner, and we'll see pictures of that later. So they can be worn in cold temps and snow. The tread on the braces that have a paw segment wear depends really on what kind of surfaces that dog is on. So if they're walking on a lot of concrete, sandstone, or asphalt, they're going to wear through that sole much faster than if they're running around in the grass and on softer surfaces. So anywhere between 6 months and a year on a sole, and then the straps can be anywhere from 6 months to a couple of years. The joints that are in these braces come from the human side, and I wouldn't say they're bulletproof, but they're pretty close. We rarely have any problems with them, so we don't worry too much about those. Physical therapy certainly should be a part of wearing a brace, and as a veterinarian that does physical therapy, that's one of the things that I teach folks is the things to do to help maintain muscle mass and range of motion, to maintain strength and proprioception while we're waiting for that brace to show up. If there are any wounds, of course, we want to take care of those, and we're certainly trying to prevent volume change, muscle mass loss. And then once we've got the brace in place, and we can see that here's one of my patients that was in a carpal brace. We're going to continue to do those exercises. We can start to ramp things up a little bit because now the joint's protected. So we'll work on weight bearing, proprioception, range of motion. Range of motion we'll typically do. We'll take the brace off in a quiet moment, range of motion of the affected joint if it's appropriate, and then put the brace back on. And then, of course, gait training, strength and conditioning. This particular pet was going 3 to 5 miles a day before it injured its carpus. Once the surgeon looked at the carpus, decided not to go in, but wanted something that would create stability for this joint for 3 to 6 months. So he talked with me, and we designed a manufacturer designed a custom orthotic that was jointed, but we hadn't opened it up yet. And so this was in the early stages of recovery. And once this dog started to gain strength, and the ligament in its carpus that it had damaged was getting better and better, then we opened that up and allowed that dog to push off a little more. And then ultimately the dog was back out of it in about 6 months. So we've reached the end of our first hour. I just put in this summary slide because I wanted to chat just a little bit about what we've gone over in the first hour. Certainly, I think that research and clinical experience is showing that orthotics are a viable option, that we have a lot of things to learn and more to understand as we implement them, and that this is something that you as a practitioner can do in your own practice. And this is a great slide of a pet in a Stifle brace doing a very athletic move, a plank. So if you've ever done these yourself in the gym, you can appreciate how strong this pet is. In our next hour, we're going to talk about 4 different cases. So look forward to working through those and telling you what my experiences were. Welcome to our second hour. So now we get to talk about case studies. And these are cases that I've seen in my practice in just the last couple of years. This case is Duke, and we used braces on all 4 legs for Duke. And then this is Mesa. Mesa had an osteosarcoma that we worked with. This is Bella. Bella had a leg length discrepancy and some twists and turns in her treatment. And then we have Angel. And Angel's an interesting case as well. She's a three-legged dog who needed a lot of support for this right front carpus, and we'll talk more about that. So we'll start with Duke. So as you can see, there's a lot of things going on here. We've got carpal hyperextension on the right. We have a dropped hock on the right. We have a hock that is dropping, on the left. And then the only one good leg that actually has a little bit of hyperextension as well is this left front. So Duke was an 11-year-old male neutered standard poodle. He had already had a neuroconsult with an MRI, and they suspected that he had a myelopathy at L6, at somewhere between L6 and S1. He had been receiving acupuncture, laser therapy, traditional Chinese veterinary medicine, and presented to our clinic for a bracing orthotic consult. What the owners really wanted was for this dog to be able to walk around on their 2 acres that they had fenced in behind the house, so that he could just have some quality of life. Here's a short video of Duke in my office, so that you can just see all the things that are going on with him. The owner here was showing me how Duke was rotating that left knee out. There is another Duke brought along his brother, so there is another standard poodle back in the corner here. So that dog didn't have an extra leg there for a moment. One of the things you can see with Duke is he sits down really quickly. Walking that way, I'm sure, is uncomfortable. So our treatment plan for him, we were going to cast for custom orthotics for the right carpus and the right tarsus. We measured him for custom soft braces for the left carpus and the left tarsus, and planned to use some thermoplast on the left rear as well. We started a rehab plan. We instructed the owner to continue therapy with their referring veterinarian, and our plan was to monitor Duke's neurological symptoms, his stifles. The right had a suspected partial tear and the left had a full tear, but neither had tibial thrust. And we would fit those orthotics when they were returned from the manufacturer. In Duke's case, one of my major concerns was to get him upright and walking. And if you can control the tarsus and you don't have a lot of tibial thrust, then you can take care of their knees just with a tarsal brace. So here are the castings that we made of Duke that day. Here we have the carpal casting. And we'll do a little self-critique here. This one came out pretty well. We've got our bony prominences extended up to the elbow. We've got an appropriate amount of flexion of the foot. When we come over here to the tarsus, extended up to the tibial crest, happy with that. We can see our bony landmarks. We're going to have to adjust a little bit for this in the brace, so it'd be good that the lab can see that. I didn't get enough dorsiflexion in this foot. The lab was able to make an adjustment for that once I talked to them, so they were able to take care of me. But just an example of what those would look like. And here are Duke's new legs. So here we have the custom tarsal orthotic. We have the custom carpal orthotic, and in this case, we didn't join it. We weren't ever gonna have him pushing off with this as much as he was hyperextending. We did a soft carpal brace, and then we did a soft tarsal brace, and we haven't added the thermoplastic to this one yet. Here you can see Duke in standing, and so here's that custom Tarsal orthotic on the right side, the custom Carpal orthotic, a little better view over on this side. Here we can see the soft tarsal brace, and we've added some thermoplastic around the back to stiffen it up, and you can get these thermoplastic kits from the manufacturers. And then we had our soft brace on that carpus. Most folks know what these are these days, but this is a help them up harness, and Duke had one, and they're very useful for these dogs that are big and sometimes hard to move around. It's nice to have a handle over the rear and a handle over the thorax to be able to pick them up and help them move around, help them get up. So another short video of Duke, and this is Duke right after we placed all of our orthotics. He's definitely lost a lot of muscle mass, and so he's a little wobbly. He needs a little support in the beginning, but as you watch him walk, and his brother there, you use him as what a normal dog would be looking like. He starts to figure it out. He's rolling back there on those orthotics just because he's lacking strength, but notice how quickly he starts to correct that. Definitely some support from mom is helpful. Having his brother there to follow around was a big deal, and Duke definitely was depending a bit on his brother for support. But tail up, wagging, and as he got used to wearing these and he built up more strength, he began to use the stairs up and down to the back deck, and he began walking the owner's property, and so the owners were very happy. And actually the story that his owner told me was that they had put on all of his braces and he was hanging out on the back deck, and they turned to do something, and the next time they looked out on the back deck, Duke was gone, and he had walked down the stairs and was walking around on the back property. And so he figured out a way to get up and down the stairs, and they were very pleased with that. Our next case is Mesa. Mesa ended up with a pathologic fracture of her tarsus, and just a little backstory on her. She was an 11-year-old spayed female Weimaraner. She had a suspected osteosarcoma of the right distal tibia that had metastasized to her lungs. During radiation therapy, it was discovered that she had a pathologic fracture of the tarsus. The owners and the referral facility realized that the ankle was actually becoming more painful, and so she was sent home in a splint, and then sent to her referring veterinarian so that they could continue to do splint changes. So here's a picture of that lateral splint on her leg that was placed by the referring facility and then by the referring veterinarian. It did improve her comfort a little bit, and so knowing that lateral splint was helping, the referring veterinarian felt comfortable sending Mesa to my practice, and so that we could create a custom orthotic for her. And the owner's goal in all of this, which I think is really important to remember when we're working with these kind of pets, was for this pet to be comfortable and to be able to go on short walks and trips. And this family really enjoyed getting in their car and going camping and going to see stuff. And Mesa had always been a big part of that. So they wanted to continue that, knowing that she had osteosarcoma in a limited amount of time. So here's a radiograph of that tarsus right around the time of diagnosis, and you can see the typical pattern of moth-eaten bone and bony proliferation that you would see with an osteosarcoma. Our treatment plan for Mesa was to measure her for a custom neoprene brace that would allow for the tumor to grow. And then we were going to fashion thermoplastic around that to create extra support. Certainly she was to continue on her current pain medications and oral chemotherapy drugs that have been recommended by the specialist. Here we are the day of fitting and creating the new tarsal brace for Mesa. And the manufacturer had created this custom soft tarsal brace from measurements, and as we discussed earlier, they had created enough allowance for that tumor to grow. And then we took a piece of thermoplastic and heated it up, and there's a couple of different ways to do this. You can buy kits with instructions in them, but you either use a warm water bath or a heat gun, and this material becomes soft and you can wrap it around the leg. What I typically do is I'll put the brace on first, then I run a piece of stockinette up over the top of this just to protect the limb and the brace. Place the thermoplastic around it, mold it to the limb. Any giant pieces of excess plastic will cut away. And then we take a elastic bandage and wrap over the outside of it, and that helps hold it in place while it cools. And then once it's fully cooled, it's stiff enough that sometimes it can be difficult to get off. So I wait for it to cool off, but not this is the art part of it, but you wait for it to cool down where it's still a little flexible but holds its shape, and then you can pop it off and trim the edges until you get it to exactly what you want. And then because the neoprene has kind of a fleece face on it, we can stick a little Velcro on the inside. We run a little Velcro on the outside, and that's how we hold it on. So we'll show you that in the next picture. So then this shell basically is a custom fit. It pops right around that tumor in the leg and around the soft brace underneath, which is poking out above and below so that we don't cause rub sores. And then we just wrap. There's another strap that you add to wrap, and it holds everything in place. Here's a front view just showing that wrap, and you can see the plastic comes around. Sometimes I'll have this plastic wrap almost all the way to the front, and other times I find it's a little easier for the clients if we leave a gap so they don't have to pull on it so much. But certainly you get a little bit more support if you can wrap that a little more. The nice thing about this was that I knew this tumor was going to grow, and as if the owner started to notice issues like discomfort or a hard time putting this shell on, then they just popped into the office. We heated this up, remolded it, didn't take very long, and Mesa was back on her way. Here's a view of Mesa standing in her brace for the first time. You can certainly see that she's been shifting her weight over to the left side. This is very common anytime we first put a brace on a dog, is that they're not really sure what all this is about, and the first thing they do is go back to what they were doing before. Now we have Mesa taking her first steps, and she was an interesting dog. She's you have some of those labs that run up to you and just are so excited to be with you and see what you're doing. Mesa was a little bit more standoffish. You can see that she's already bearing better weight. She was using it well. The technician I was working with that day immediately said to me, "Oh my gosh, she's doing so much better." And she certainly was walking better. She's dealing with some pain. There was an osteosarcoma there. So our goal really was to increase her comfort and mobility. And as we videotaped her, she was like, "Yep, I'm done. See you later." Here's a picture of Mesa 2 months later. This radiograph was taken with the brace applied, and you can see that the tumor is becoming more aggressive and growing. She continued to be more comfortable in the brace, and the owners were able to do the things they wanted to do. So we were happy with that outcome. Our next case is Bella. Bella was a 7-year-old spayed female German Shepherd dog cross, and she had a history of a leg length discrepancy with a lameness that started in the fall of 2018. And so here's just a couple of static pictures of her showing that right rear leg. Very common for her to come in toe touching with a right hip drop. I like to share this slide with folks. These x-rays are just really amazing to me. When Bella came in, of course, she was standing on her right rear toes. It was obvious that she had decreased muscle mass in that right rear limb. We can see that here on this x-ray. There was a fusion in that right stifle joint, and which is significant. Another significant thing that we saw right away was this leg length discrepancy. And at first we thought, well, gosh, they didn't get the x-rays straight. And then the more we looked at her and subsequent x-rays, we realized, nope, this is the way she's made. And so there was a 25 millimeter leg length discrepancy. I've got another slide that actually shows that. This limb, if you look, there appears to be an old fracture line right about here. I think maybe just a little bit of discoloration to show that an IM pin was placed. And so our suspicion is that before the owner got this dog, because she was an adoption, is that she fractured this leg, had a growth plate injury, and the condyles twisted a little bit actually on the repair. And so here we have this dog with a leg length discrepancy. I also think it's really interesting to look at the cortex on this dog. How we have this nice thick healthy looking cortex on the left rear, and then this really thin kind of wavy cortex on the right. So we did diagnose her with a leg length discrepancy. We suspected a partial tear of the CCL and an iliopsoas strain. The owner, after discussing custom Stifle braces, custom tarsal braces, which would be more effective, and surgery, decided that he just wanted to do rehab. He was skeptical about all of it, and we really felt that the custom tarsal orthotic with a lift was going to be the best thing for this dog. We could control the knee support as well as support the leg so that it was the correct length. But he opted for rehab instead, and things were going well for a while, and then we had a catastrophe. But I wanted to show this video first. We'll see if that works. Hey, all right. So here's Bella moving back and forth. She was comfortable. This is a dog that was doing 2 to 3 miles a day with the owner before she got injured, and at this time they were able to start going on a little bit longer walks. He was happy with her progress. She had always walked this way, so he was comfortable with that. But as you can see in the slide, on January the 15th, she jumped off the bed and everything changed dramatically. That partial tear that we thought she had became a complete tear. And then this is the day of surgery. So x-rays taken again, we confirmed that leg length discrepancy. After discussing the different types of surgery that could be done for this dog, the owner elected to do a CBLO. There was actually a 26 millimeter difference in the limbs when we measured them, and we noted that twist in the condyles that we thought was as I'd mentioned earlier, that we thought was secondary to an old distal femoral fracture. And the condyles were rotated to about 45 degrees. Here's a picture of her CBLO. These, I believe, are becoming more and more common for the folks out there that haven't seen one. You know, the TPLO makes a cut in this direction, a curvilinear cut. CBLO makes a cut in this direction, so just the opposite. The upside of a CBLO is you can do it on a really young dog because you miss the tibial crest and its growth plate. And they tend not to have any cranial drawer or very minimal cranial drawer when they come out of surgery. And in this case, unfortunately, Bella had totally trashed her medial meniscus, and so the surgeon had to remove all of that. At the end of surgery, we left Bella under anesthesia. Here you can see that scar from her previous surgery on her femur. What I typically do is I'll lay Telfa pads over the incision, and then we'll put plastic wrap around the leg to protect the leg from any moisture. Plastic wrap right off the roll is essentially sterile, so we don't worry about that. And the Telfa pads are there just to give me some extra confidence in taking care of that potential wound while it's hasn't sealed yet. And then we go through the normal casting process. We put the animal in a normal standing angle that you can see that we've done here. Typically we'll get the tarsus around 130, 135 degrees. In this case, we knew that we were going to add material to the bottom of it, and we'll show you that brace here in a minute. But everything was in place, so once this hardened, we cut it off, and then the surgeon was able to place their post-operative bandage. While I'm thinking about it, folks always ask me, do you need to anesthetize these patients to get a good casting? And 95% of my patients, I just do with them awake. We'll have the owner helping, a technician helping, and we can get it done pretty quickly. Every once in a while, I'll have a really squirrely dog or a pet that isn't just going to cooperate. Or if we have the opportunity, they're going to be under anesthesia for something already, then we'll take that opportunity to go ahead and get things done. But typically, I don't need it. This is what we came up with for Bella. We knew we had measured a 26 millimeter leg length discrepancy. We ended up, we went with a 25 just to make life a little easier and to give ourselves just a little bit of wiggle room. Certainly, I get questions sometimes from folks about, well, how much sole material are you adding? Does that create an issue? You know, in the human world, if you raise one leg by more than a quarter of an inch, people can tell. Dogs, because they stand in flexion, don't tend to be bothered by that as much. But certainly when we get up to the amount of discrepancy that this pet had with a hip drop, it's time to do something about it. So we chose an articulated. There was nothing wrong with her ankle, so we chose an articulated version. With this version of the tarsal brace, what happens is that it locks in weight bearing. So the joint's right here. So there's pressure against the front of this cuff, and so it keeps the tarsus from hyperflexion, but at the same time allows them to push off. And this in turn helps also control the knee. And then we started our weight bearing schedule. So if you remember, she actually had surgery like the middle of January, and the brace came back, and we checked the fit, and the fit was good, but because she had had her entire meniscus removed, she was still pretty gimpy. And we decided to delay the start of the brace until she became more comfortable. It didn't make sense to us to create more issues for her. So we did delay the start a little bit. So here we are the first week of March, and have her in her brace. And so here's a video of her walking that very first day. So pretty common. She's a little tender still in that stifle, so it doesn't surprise me that she's still kind of toe touching with it. Certainly she is using it well enough for us to keep it on her. And as time goes by and as things heal, you'll see that she uses it better and better and better. So a week later, still a bit gimpy, but using it more. She's picking it up. She's figuring out how to use it, moving it forward. Dad has a lot of orthopedic problems himself, and you probably noticed that he's got this sheet over his shoulder, so he was always ready to help support her if she needed it. These are certainly A-plus clients. They come in and work with us, and so it was all about Bella and what we could do to take care of her. But we were real pleased to see her use it. There you see her shake it a little bit. Not unusual in the beginning of having a brace on. Now we're up to 3 months post-op. You can see she's using it in almost every step. And she'll get stuck there for a minute. You can see her jump and pull. There was another dog around the corner there that she wanted to go see. And she'll head back here in just a second, and when she does, we can see how she's doing. And I think it's really interesting. Anytime you have, whether it's your technician or a client guiding a dog, and definitely he's putting some tension on her leash, it tends to push a dog around a little bit. And when you look at this second video, look how she moves. This is the same day. Look how she moves without any interference from a leash or a collar. She's standing, she's putting weight on it. She's moving side to side. She'll actually go backwards here for us. She's got that external rotation because of the change in where the condyles were. And so one of the things that we noticed over time was that she tended to wear the inside of that brace. But I was happy with the level of her hips and her mobility at 3 months post-op. So one problem we did run into, and we had talked about earlier, was a little bit of a sore. And so this is 4 months post-op. We had a bit of a pressure sore. The owner was on top of it very quickly. So you can see really all we've got is hair loss. The skin hadn't even been abraded at this point. And it was right over the edge of the CVLO plate. My experience with TPLO plates and CVLO plates has been that over time the bone kind of grows up around the edges and smooths them out. So in this case, what we did was we took a red lipstick and we outlined that, and then we just put her in the brace. And when without any of the neoprene padding that goes on her foot, and that indexed on the inside of the brace. And here you can see that. So here we've got this red mark, and typically I would take this and send it into the manufacturer. They would heat the plastic and create a little bit of a relief here. In this case, the owner was adamant that Bella stay in her brace because he felt that it was really helping her, and they were already starting to go on their long walks again. And so he wasn't about to let it out of his sight at this point. So what I did was I took a little 1/4-inch foam and created a little donut relief just to take a little bit of pressure off that, knowing that it might work and it might not. In this case, it did. But sometimes they do have to go back to the manufacturer to get that pushed out a little bit. And what happened over time was she just kind of wore this flat. The bone grew up around the plate. The sore totally went away, or the rub spot totally went away, and he was very happy. So here we are, ready for a refurbish. About 6 months later, you can see she's wearing off the sole. This brace tells us a lot of things. We know she's wearing it She's kind of rolling off the inside edge a little bit from the condyles. She's obviously using it. It's dirty, and the straps are getting warm. So was real pleased that she got 6 months out of it, because this is quite a rough and tumble dog. Our last case of the day is Angel. Angel's a dog that we ended up putting a carpal brace on, but she only has 3 legs. So her story is that she was shot through the right front carpus and through the left stifle, and an animal shelter called Second Chance Humane Society picked her up, or the animal was brought into them. They took over the case, and then working with a couple of different veterinarians and the surgeon that I work with, she had the left rear amputated because it was just destroyed. And the right front leg had a bullet that went through the carpus. And so here she is in a bandage early on. And our hope was that this right front carpus was going to fuse, but she had other things in mind. A couple of x-rays here to show what was going on with Angel. So early on in her recovery, she began to run a fever, and blood work was redone, and her platelet count was low, and she ended up being Ehrlichia positive. And as I had mentioned earlier, our hope was that this carpus was going to fuse and these bones were going to fuse together and create some structure here. And because of the Ehrlichia, we feel that the bones just healed over instead of doing what we expected. Certainly we have this foot that kind of has that's turning in immediately, but she also had a valgus deformity of the carpus. So we really needed to stabilize this carpus in this foot. And this is 2 months after her original surgery. What we decided to do at that point was to create a custom orthotic. She'd been in bandages every week. We were getting bandages changed every week, and was starting to develop sores and all kinds of things. And so early on, when we realized that she was going to need to be in a cast of some kind long term, we started talking about a custom orthotic, because we can take the custom orthotic off 3 to 4 times a day, check for wounds, check for sores, do range of motion like we had talked about before. So she was one of those pets that I needed to sedate to get to hold still. She was a young dog, so kind of squirrely. The friendliest dog ever, but trying to get her to hold still was a little difficult at times. And you can see that we have our stockinette placed over the limb. Here's our cutting strip down the front. We've got a nice angle in the foot. The surgeon and I put our heads together and decided on a standing angle and reduced that carpal valgus. And then we allowed it to harden and took it off. And here's the finished product. So what we came up with was this articulated brace in this case. We wanted her, at this point she was getting pretty strong, and so we felt that that we would let her push off with that, but we could stabilize the wrist enough, and especially because she was 3-legged. If she would have been a 4-legged dog, we might have talked about having this solid at first and then creating a joint for it later. But because she only had 3 legs, she had to be able to push off with this limb. And it's really interesting to watch her move, and you'll see this a little later, but she really depended on this leg. So that's why we ended up with a hinge in this case. But we were happy with the fit, and this dog is an amazing dog, and so she took to this brace right away. So a few videos, her first walk in a brace. She did do some of the things that we talked about. And and I think it's maybe in my next video, but here we can watch her move. She was used to walking around with a cast on that leg already, so she took to it pretty well. But this next video, you can see she did the classic, I'm done. And hesitation is something that we see all the time. When we first put these braces on, a lot of dogs were like, what is this thing? It weighs a little more. It changes, maybe, it feels different. And so they'll sit down and they'll wonder, what's next. And this is where a little patience and doing something fun helps to get these guys going. This is our 2-week recheck. I took the opportunity to just go out to the Humane Society and kind of see Angel in her natural environment. So we have a couple of videos here. The staff person that she was living with lived up on this second story, and so she was going up and down the stairs, and I think you can see here that she was doing that pretty well. Angel never goes anywhere slow, and I think certainly part of that is because she's only got 3 legs. It's a little easier to get around if you go fast, but I think it's all a part of her personality as well. At her 2-month recheck, she was doing well. Here you can see that she's standing pretty square at this point on both legs. The little bit of extra sole here wasn't creating a problem for us as far as shoulder pain. She actually was doing incredibly well. I expected to have some discomfort with her, but the owners were doing a really good job of massage and warm compresses and range of motion, that kind of thing. So she was just doing fabulous at this point, and we were really excited. You can see the wear that she has, pretty symmetrical across the sole. Certainly she's putting a little more weight to the outside of that, but was happy to see what we had going on here. And then just another view from the front. You can see she's rolling off the toe, which is really good to see. You can see the rocker that most of these orthotics will have just a little bit of rocker just to make it easier to place the heel and roll off, or what we would call the heel and roll off. And then 4 months after our first fitting, things are continuing to go well. She's continuing to wear this sole still fairly evenly. There's a little bit of lateralness going on here. We were monitoring the carpal valgus on this dog as well, and it was not getting worse. The owner was was really compliant and keeping this dog in a brace, so we were real pleased with that. So one of the things that we ran into was about 6 months in, this wrist started to thicken. And I think a couple of things were going on here. I think that she was a young dog. Things hadn't totally healed yet. She had some growing left to do, and so the carpus was getting thicker, and the bore of the orthotic was wasn't getting any bigger with her. And so although we could get it on and off, it was becoming a really snug fit. Certainly she was increasing, the strength the dog had was amazing. So we went ahead and we cast for a new brace. We tried a couple of times to alter the brace and make it a little bigger, and it just wasn't working out the way we wanted. So we decided just to start again. And so here's our second brace casting, very similar to the first. And then 3 weeks later, we had our new orthotic. So here's our old orthotic, and you can see from looking at the diameter here that it's smaller than this one. One of the things that's kind of fun to point out is you can see these 2 middle digits. So these were the 2 digital pads. That'd be what gotta count their 3rd and 4th digits, and that looks great. So that's one of the little things that you can look at when you're looking at a brace that's in use. if these were way over to one side or the other, then we'd need to evaluate our viral far forward as well. We need to evaluate that fit and make sure that's really what we wanted to have happen. And a picture of Angel without her brace. So now you can see she's getting pretty strong. She certainly has begun to use this right front leg to bear a lot more weight as it's gotten more comfortable. The valgus deformity is there, but it's not breaking down, so we're happy with that. And she's just a happy-go-lucky dog. So this is 6 months post-op, and this is her without the brace. You can see how she just goes, everywhere she goes is fast, and that's just Angel. But gets along well. And then our next, here we have some video of Angel in her custom orthotic. One of the discussions we had was whether or not she would ever come out of this brace, and given that she handles the brace so well, that she's three-legged, and that we were certainly concerned that she might start to break down that leg sooner if she was out of the brace, that we just decided that it was best to keep her in that. So that's our long-term plan. I did want to include another video of her just doing a little maneuvering in that brace so you can see that. So we've got a little bit of cavalettis in the office, just showing her sitting and going back and forth. One of the questions I get a lot is how do we protect these boots for the dogs that, rather, how do we protect these braces with the dogs that are really active and out in the mud and out in the snow like we have in Colorado. And there are commercially available sleeves or a boot, and so it has a walking sole on it, and then a waterproof cloth with some straps to help hold it on that you can buy commercially, and those work well to cover up that limb while they're outside and keep the snow and dirt out of there if you need it. Angel has become the rescue ambassador for Second Chance Humane Society, and here's a picture of her walking around in the snow. Certainly does not slow her down. This is a day without a sleeve. She now has a sleeve that she wears on that, and like I said, she is about 100 miles an hour all the time. She's also one of the dogs that goes to the library and allows, sits and has the kids read to her. So she's become quite the dog and is very popular in her area. Well, we've made it to the end. Thank you for listening to Canine Orthotics and You. I've listed some resources here for you. Our website, goherogo.com, our resources page, and a blog that we recently wrote with casting tips. And within that, there are videos showing you the casting process. If you have any questions, again, please feel free to reach out. You can email us at hello@goherogo.com. Again, I hope you had fun. I know I did, and have a great day.